Good evening, and thank you for joining us for tonight's webinar, Treatment Options for BPH Enlarged Prostate, presented by Dr. Vik Uberoi. Dr. Uberoi practices general urology and focuses on the treatment of enlarged prostate BPH with innovative therapies, including UroLift. He is a frequent speaker on urological issues and has published articles in multiple medical journals on a variety of urologic topics. His honors and awards include a poster of exceptional merit from the American College of Surgeons and honors in functional systems and physiology at the University of Maryland. Dr. Uberoi is a member of the American Urological Association and the Endo-Urology Society. Welcome, Dr. Uberoi.
Okay, thank you very much. And thank you for all of you for joining us tonight. This is probably my third or fourth BPH talk, and this is the first one I'm not doing in person, and I can't wait till we can do this again in person. But tonight, we are going to talk about enlarged prostate and what are some treatment options, what are some symptoms, and then what are some things that we can do about it. And we will do all the questions at the end, but hopefully we all get some good information out of this. We'll talk about what your prostate is, what is BPH or benign prostatic hyperplasia. We'll talk about how it's diagnosed and what the different treatment options, with a special focus on something that I'm sure a lot of you have heard about, which is UroLift. It's something we're doing a lot more of these days because we do strongly believe in it as a treatment option. It has a nice space within the whole realm of treating BPH, and we'll talk about all of that. A lot of patients' first question is, well, if my prostate is enlarged and I'm having symptoms from it, can't you just take it out? What do I even need your prostate for? And the answer is that the prostate is very important when you're younger. It is involved in the production of fluid that transports sperm or semen. So it makes semen that helps sperm get to try and fertilize an egg. After the age of whenever you're done having kids, there isn't a lot of use for it, but it can cause a lot of problems, whether it's enlarged prostate or prostate cancer. But we generally don't recommend just taking out the whole thing for a slew of reasons that we can get into. But in general, it's a small walnut-sized gland at the base of the bladder. It surrounds the urethra. Part of the urethra is called the prostatic urethra, which is the part that the prostate is surrounding. And it's really intimately associated with the bladder. When you're young, your prostate is very, very small, and that might be why kids and teenagers have such strong urinary streams, because they don't really have a prostate that's going to cause any issues. As you get older, first when you hit puberty, it starts to get bigger. And by the time you are in your mid-40s, that's sort of at the next age where things start to move. And once you get in your mid-40s and above, in response to certain hormonal changes that all men go through, your prostate tends to grow and get bigger. So it's important to know exactly what we're talking about. So you might hear a lot of these terms, whether it's prostatitis, prostate cancer, or enlarged prostate, otherwise known as BPH. It is really important to distinguish what these terms are. So prostatitis is a condition in which your prostate becomes very inflamed. The symptoms of that can be frequent urination, pain with the urination, maybe pain referred to the tip of the penis or the rectum. It's something that's treated with antibiotics and anti-inflammatories and tends to get better. Prostate cancer obviously is a completely different beast than enlarged prostate. Prostate cancer is typically very slow growing. It's very common among older men. It certainly has its own treatment options and issues with the treatment. But today we're talking about an enlargement of the prostate gland, which obviously the first word is benign in BPH. And you have to remember that this is non-cancerous growth of the prostate. As you get older, the number of men with BPH does go up. As you can see, at age 60, there are about 70% of men are diagnosed with enlarged prostate and can have symptoms of enlarged prostate. It's actually quite rare that you would see an 80-year-old male that does not have symptoms of enlarged prostate. BPH is called benign prostatic hyperplasia. It's non-cancerous enlargement of the prostate gland. It has nothing to do with prostate cancer. Patients with small prostates can have prostate cancer. Patients with large prostates can have prostate cancer. There is the blood test called PSA, which I'm sure a lot of you have heard of, is a test that may be increased in both BPH and prostate cancer. So if your PSA comes back elevated, but you have a very large prostate, it's actually a reassuring thing that it may not be that your PSA is increased or elevated because of prostate cancer. It is true in general, if you have a larger prostate, your PSA level is usually a little higher. So as the prostate enlarges, it can push pressure on the urethra and make it more difficult to urinate with a strong flow. In general, the size of the prostate doesn't always correlate to the severity of symptoms. So, again, patients with small prostates, if they happen to be obstructing, can still cause the same symptoms of someone with a large prostate with very little obstructing tissue. It all depends on the shape and the anatomy of the prostate. Over time, the prostate can cause some obstruction that the bladder can overcome at first. And the bladder muscle can get stronger and it can push with a high pressure to get the urine out. Unfortunately, over time, the bladder muscle can become so large that it actually stops working as well. And it gets replaced with a lot of inflammatory tissue and other tissue that's not really good at squeezing. The problem at that point is that's really an irreversible situation. The best thing we could do is relieve the obstruction and try and preserve whatever bladder function we have left. So as it goes on, you can see from the picture on the bottom left, you still have a pretty good channel. This is now looking from the prostatic urethra into the bladder. And you can see over time, as the prostate gets bigger, the channel through which you can pee gets more and more narrow. So all of our treatment options are really aimed at opening this channel and making it wider and basically turning what looks like a 1 or 2 lane highway into a 6 or 7 lane highway. So what are the symptoms of enlarged prostate? I actually like this slide better. The most common symptoms are frequent urination, waking up a lot at night to urinate, urgency, standing there and waiting for your stream to start. Back when we were able to go to ball games and things like that, if you are standing at a urinal and you're getting lapped by other people, that could be a sign that your prostate is enlarged. Having a weak stream or dribbling, feeling like you don't empty your bladder all the way, or recurrent urinary tract infections are always a sign that something could be going on with your prostate. It is a quality of life issue, as well as it could be a medical condition that can cause issues with your kidneys and issues with your bladder. But in terms of quality of life, many men may have a reduction in the quality of life due to avoiding travel, interrupting of leisure activities, locations in which they urinate, or just not getting good enough sleep. How do we diagnose it? The first thing is always a history. This is something you can actually partially figure out on your own. This is a very simple way, and most men will do this, is when you pee, you do tend to notice how strong the stream is. It's very easy to remember the old days when you used to be able to write your name in the snow. It is a good idea to think about it before your appointment in terms of where you would sort of put your stream in relation to where you were when you were younger. Most men will say their stream is not as strong as when they were younger. But as part of the history, we will go over how often you urinate at night, how good is your stream, how much urgency and frequency you have. Then we will do a physical exam that usually does involve a rectal exam. One of the things, obviously, we're doing more and more virtual appointments. We can certainly start with a virtual appointment as a workup for BPH. We can't do all of the things we can do in the office, but some men try and get out of that rectal exam by having their first visit be a virtual visit. And some men, you'd be surprised when I'm on the computer doing a virtual visit and I say, okay, it's time for your rectal exam. Now turn around and bend over. Some men still actually try that. And I always tell them, I'm just kidding. We also can evaluate your symptoms with something called the International Prostate Symptom Score, or IPSS. It's just a little chart that we have you fill out, and that can help us figure out how bad your symptoms are. And the most important part of that is the bother score. Other studies we sometimes do is something called a Euroflow or pressure flow studies, which basically measure how fast the urine comes out and how much pressure your bladder is able to generate. We can get an ultrasound to look at the size, whether that's through the abdominal ultrasound or transrectal ultrasound. And probably the most important part of the workup is something called a cystoscopy. So cystoscopy is a camera test. It's like a colonoscopy, but for your bladder. It sounds way worse than it is. Basically, it's about a 45-second test where we numb up your urethra and take a camera and basically go from the tip of the penis all the way into the bladder. And we get a really good sense of your anatomy and how much obstruction you have from your prostate. Let's say you've come into the office and we've decided that you're having symptoms of an enlarged prostate, whether you're retaining some urine or your pressure flow studies show that your bladder is obstructed. What are the options for treatment? Basically, all of the treatment options have a role in the treatment of BPH. We always like to start with the least invasive and go to the more invasive. So the least invasive obviously is just watchful waiting. The advantages are you can't have side effects from it. It's cheap, it's easy. Sometimes with watchful waiting, we also discuss behavior modification, conservative management, like trying to cut off your fluids at night, things like that. The disadvantages are we really know that most people progress from watchful waiting to treatment. So this is not a good long-term strategy. The symptoms don't tend to improve. Once your bladder has sort of suffered some muscle breakdown to where it's not squeezing as well, that usually does not get better. Now, a lot of patients are on medications for enlarged prostate. The most common ones you might have heard are Flomax or tamsulosin or finasteride, which is another one. The advantages of medications, obviously, is you do avoid any procedures. They may give you good symptom relief. There certainly is a role for medications. However, the disadvantage of medications are definitely increasing in number. The most common things to discuss are that, number one, these aren't medicines you take for 6 months and then you stop. If you stop them, you'll go back just to the way you were. You will basically be on these medicines for the rest of your life. My personal opinion is people take too many medicines as it is. Patients sometimes walk in with 3 or 4 blood pressure medications and medicines for cholesterol and all this stuff, and they're basically just walking pharmacies. And if there's a way that we can keep people off medicines with other treatment options, that's certainly something that I'm in favor of. Some of the side effects of the medications for BPH are sexual in nature. You might notice lower sex drive. You certainly have a high chance of ejaculatory changes, meaning that either not as much semen comes out when you have an orgasm, or no semen comes out. Some of the medicines can cause dizziness, lack of energy. There have been some new studies that have showed a higher incidence of cognitive delay or dementia in patients over the age of 80 that have taken it long term. So these are all sort of considerations when we start somebody on medications. I tend to use medications as a trial run or a test dose where I might have a patient be on a medication for 30 days just to see if the prostate is an issue. If in 30 days the patient comes back and says, well, I'm much better, but either I'm having a side effect or I don't want to be on medications long term, at least I know the prostate is the issue, and we can go from there on and talk about ways to get patients off of medicines. A quick word about herbal remedies, saw palmetto, things like that. I don't recommend them very frequently. And the reason is that the clinical trials have not shown them to be beneficial. They're costly. Personal opinion is I like to stick to prescription or FDA approved drugs that I know are regulated and I know what's in them. Now, we're here mostly to talk about UroLift. This UroLift falls under the category of minimally invasive procedures for enlarged prostate. UroLift has several advantages, including preservation of your full sexual function. They did 12,000 patients in the original study with UroLift, and their incidence of retrograde ejaculation or ejaculatory dysfunction was 0. It does not tend to have any effect on the quality of the erections as well. It tends to have a very rapid symptom relief and recovery, and can be done under local anesthesia or IV sedation. At the most, it is usually just like colonoscopy type sedation. There are some patients that require a catheter afterwards and some do not. And the results have been shown to be very durable. The disadvantages of UroLift, there are certainly some disadvantages of having to have a procedure. You have to go to sleep and have the risks of anesthesia. There is a little bit of a recovery period. We typically say anywhere from 7 to 10, maybe 14 days, where you might have some discomfort while urinating, so urgency and frequency. Those tend to resolve by about 2 weeks after the procedure. Now, just to go over a few other treatment options before we delve back into UroLift, you might hear about heat and steam-based therapies. The most common one right now being used is something called Resume. Also has a place in the treatment paradigm. It is very similar to UroLift in that it takes just a couple of minutes to do, and it's an in-office procedure. However, you do have to have a catheter for longer with Resume, and there could be typically is a little bit of a longer recovery period. And then finally, the tried and true method is something you might have heard of called a TURP. Some people call it a Roto-Rooter, green light laser. This is kind of the more aggressive form of resection of obstructing prostate tissue. It does have very good symptom relief and has long-lasting results. However, it tends to be the bloodiest of all the procedures with the longest recovery rate. It can have some erectile issues and ejaculatory issues with this, and it may be something that requires a hospitalization in order to perform the procedure. Not all the time. Now, a little bit more about UroLift. So what UroLift is basically a set of clips that we use that open up the channel and basically pin the prostate to itself to keep the channel nice and open. It is a very, very simple process. It's almost embarrassingly easy how the procedure is performed. The tabs or the implants that we use are very, very small in real life. They're smaller than the size of a dime, and they're basically made of a capsular tab with one little piece of stainless steel and a permanent suture. I'd like to show you a video of how it's done, and then I'll talk a little bit more about it. So this is just a quick 30-second video. Basically, This is, like I said, done with you either awake or asleep. The full procedure takes about 3 minutes to do. Depending on the size of your prostate, we will use anywhere typically from 4 to 6 clips, depending on the size of the prostate. Basically, just using the clips as curtain holders, kind of, that keep the prostate nice and open, and basically keep the channel open, as you can see here. Now, a lot of people might ask, well, won't I just leak constantly when I have that? And the answer is no, because the sphincter, or the area, if I can take you back to right here, the sphincter that holds the urine and stops you from leaking is all the way down at the bottom, basically at 6 o'clock in this picture. So the sphincter is left intact. So there really is a very, very minimal rate of having incontinence after this procedure, almost unheard of. So this is a before and after picture. So on the left, you see before, the prostate lobes are what we call kissing or coapting lateral lobes, which is a perfect anatomy for UroLift. And then afterwards, you can see a nice open channel with clips sort of holding everything to the side. So most people typically after the procedure will have side effects for about 7 to 10 days. By about 2 weeks, people will notice that the recovery period is over and some of the urgency and frequency is gone. And within 2 weeks, you start to notice that your stream is better, you're emptying more, hopefully going to the bathroom less. The most common side effects, like I said, might be a little bit of blood in the urine, some urgency and frequency. Most of these symptoms are very mild and are resolved by about 2 weeks. A lot of patients ask, well, how long is this going to last? And that's the part that's a little bit hard to really say with any data. The procedure has been around for over 5 years, probably about 7 or 8 years at least. I know it's been about 15 years since it was developed. And the data that they have is now out to, I believe, about 6 to 7 years. And the retreatment rate is quite low. Coverage. A lot of patients ask about insurance coverage. Aside from your own copay and each patient's deductible, it is covered by Medicare nationally, and almost all non-Medicare plans provide coverage. The thing that sometimes is something we have to consider is whether they will cover the anesthesia or whether it can be done under local anesthesia in the office or whether it can be done under IV sedation. Sometimes we do have to look at your insurance and see what we can offer. And that's something that our office or our schedulers are very comfortable doing. That's really all I had to say about the treatments for BPH and specifically UroLift. We have several doctors in the practice, including me, who have an interest in BPH and getting patients to pee like they did when they're in their 20s and 30s. That's really our goal. Basically, when you can call and make an appointment, like I said, we're happy to do virtual appointments these days. Hopefully everybody is going to sign up for the vaccine. And once we get back to normal, obviously we'd like to have the office full and helping patients get back to the way they used to pee when they were younger and getting good sleep and all that good stuff. Obviously, BPH and enlarged prostate is something that it's an exciting time to be a specialist in this because there are so many different treatment options. Again, as I mentioned, there is a push to get away from medications and get patients onto longer-term therapy that hopefully will give better results with fewer side effects than medications. My office is in Silver Spring by Leisure World. We have several doctors in the office that can perform UroLift or do other BPH procedures. So we encourage everybody to call our office or send us a message online, and we're happy to see you guys. We are open for business. We have plenty of COVID protocols in place and hope to see all of you soon.